my name is Jo Rolls and I'm a podiatrist and I run Melton Podiatry Practice in Melton near Woodbridge. Today I want to talk to you about fungal nail infections. It's not a particularly glamorous subject, but it is something that bothers a lot of our patients, and we see a lot of patients in clinic for this every week. It's a very, very common problem. Potentially if I saw 10 patients a day, 6 or 7 of them would have a fungus in at least one nail, if not more. Now, the first thing patients usually notice is a discoloration in their nail. It can be a bright yellow, a brown or white discoloration. The nail changes texture, it grows quite thickly and it can be very crumbly. What we tend to do here is we perform a very simple test. Now, before treating fungal infection in a toenail, you need to make absolutely sure that it is a fungus, that it's not just discoloration, and it's not some kind of nail dystrophy, thickening of the nail that can look a bit darker. It can have a brown discoloration to it. Now, a third of all the fungal toenail infections are misdiagnosed in the country. So potentially for every 3 patients that I or a doctor or a nurse might see, one of those patients is misdiagnosed as having a positive fungal toenail infection and they're treated for that with a medication that's completely unnecessary. So what we like to do here is a very quick test. It takes about 5 minutes to do within your appointment to accurately diagnose, get a positive result before we start any kind of treatment, before we offer an ongoing treatment plan here. So the patient comes in, we take a nail sample. That's the important part of the process. You have to take a really good sample from the right place in the nail. This is sometimes where patients fail. They've been to see their GP, they might be sent off to take their own nail clipping. If you take it from the end of the nail, that's not the best place to take it from. As podiatrists, we know exactly where to take that sample. When we have the nail sample, we drop it into this little test tube here. We add a buffing solution to that nail sample, so we drop that in, give it a quick stir, and then we set it all aside for about 5 minutes. So this test is very much like a pregnancy test for fungus, and I say that in the respect that we use a sample stick. Once that solution has mixed and settled for about 5 minutes, we dip the sample stick into the test tube, and there are a series of lines either indicating a negative or a positive result. So if we get a positive result, we will work through with our patient what the best type of treatment is. We can reduce the thickness of the nail. The treatment generally needs to get right to the nail bed where the fungus lives. Many people think it lives on the surface. It actually lives underneath, on that nice pink skin underneath your toenail. So we need to deliver a treatment right there. So you don't necessarily need to go and see your GP or your practice nurse for this problem. You can come directly to a podiatrist. There's absolutely no need to be embarrassed. We know a lot of our patients they don't like the thickening of the nail, the discoloration, the fact that sometimes the nails have started to fall apart, and they just don't look very nice. What we would say is now is a really good time of year to have a diagnosis and also to start your treatment. Fungal nail treatments don't resolve this fungal infection overnight. It can take months. So actually starting a treatment in November or December, hopefully by the summer when you want to have bare feet or you want to put your open-toed sandals on, the fungal infection may be resolved by then. So now's a really good time to come and see a podiatrist. We have several podiatrists here. We have myself, Vicky, we have Katie and Savan. We also have Alison, who is a podiatry assistant. So we're one of the biggest hubs for everything to do with feet in this area. We have the greatest experience. I think we totted up over 100 years in clinical practice with all of that knowledge behind us. So if you'd like to get in touch, we'd be grateful to hear from you. You can reach us at www.meltonpodiatry.com, or you could give us a ring. You'll speak to Cherie on reception. Our phone number is 01394 383 495. Bye bye.